This video is for information only and does not replace advice from your GP or another qualified healthcare professional. If you have concerns about your health, please speak to a doctor. Does Anavar help with erectile dysfunction? The short answer is no, and it may actually make things worse. Here's what you need to know. Erectile dysfunction is something many men deal with at some point, and it's completely understandable to look for solutions. But some men are turning to anabolic steroids like Anavar, hoping it might help. The evidence tells a very different story. Anavar is the brand name for a synthetic steroid called oxandrolone. Originally developed in the 1960s for medical conditions involving muscle wasting, it works by mimicking testosterone, binding to receptors in muscle tissue and promoting muscle growth. But here's the important thing. Anavar is not licensed in the UK. It's classified as a Class C controlled substance under the Misuse of Drugs Act 1971. While personal possession isn't a criminal offence, it is illegal to supply, manufacture or import with intent to supply, and importation by post or courier, even for personal use, is also prohibited. The MHRA strongly advises against buying it from unregulated online sources where products may be counterfeit, contaminated or incorrectly dosed. So what actually happens when men use Anavar hoping it will improve their sexual health? Some men do notice an initial increase in libido when they first start using anabolic steroids. But that early effect doesn't last, and prolonged use causes a much bigger problem. When your body detects high levels of an external androgen like oxandrolone, it responds by shutting down its own natural testosterone production. This disrupts what's called the hypothalamic pituitary gonadal axis, essentially the hormonal communication system that tells your body to produce testosterone. The result can be reduced natural testosterone, erectile dysfunction, and reduced fertility. So rather than treating erectile dysfunction, Anavar can actually cause or worsen it. What makes this particularly concerning is the recovery timeline. After stopping Anavar, research suggests it can take anywhere from 6 to 12 months, or even longer, for natural hormone production to return to normal, and for some men that impairment may be permanent. There are also broader health risks to consider. Anabolic steroid use is associated with cardiovascular effects, liver strain, and other serious health concerns, particularly with prolonged or unsupervised use. The good news is that there are evidence-based treatments for erectile dysfunction available through the NHS. PDE5 inhibitors, a class of medication that includes sildenafil, which most people know as Viagra, are a well-established first-line treatment. Lifestyle changes can also make a meaningful difference, and for more complex cases, specialist referral may be appropriate. These are all options worth discussing with your doctor. If you've used anabolic steroids and are experiencing erectile problems, it's important to speak to your GP. They can carry out a proper assessment, which may include repeat morning testosterone tests if low levels are suspected, in line with UK clinical guidance, as well as an evaluation of your cardiovascular health. Don't try to manage this on your own. A healthcare professional can help you understand what's happening and what your options are. So to recap, Anavar does not treat erectile dysfunction. It can cause or worsen it by suppressing your body's natural testosterone production. Recovery after stopping can take a year or more, and in some cases may not be complete. Safe, evidence-based treatments are available. Speak to your GP about what's right for you. If you found this helpful, leave a comment below. We'd love to hear from you. And if you want more straightforward health information like this, make sure you like this video and subscribe to the Bolt Pharmacy channel.